Mama, welcome and a happy new year. I'm Jasan. I'm a nurse and a first-time mom sharing my experiences with motherhood, helpful tips and my knowledge to help other first-time parents. In this video, I will share with you what to expect from your body after giving birth to your baby. Although body changes may differ between women, majority of the changes mentioned in this video will apply to all moms after they've had a baby. Awaiting the arrival of your baby can be exciting and nerve-wracking at the same time. You're excited to meet that tiny little human that you've fallen so deep in love with, but on the other hand, you're nervous for the labor and delivery process. This is completely normal. I did share my labor and delivery story. I've placed the card right above up here and I did put the link in the description below. In that video, after sharing my experience, I shared 10 tips on what you should do and expect prior, during, and immediately after having your baby. So you'll want to check that out once you're done here. Keep in mind, everyone's experience will be different. So let's talk about the uterus. After baby is born, the uterus will start to shrink to its normal size. This normally takes around 6 weeks, although it may happen sooner for some women and may take a bit longer for others. You will notice that the nurse will massage your tummy after birth. This may be uncomfortable or even painful, but it is necessary. Massaging the uterus causes it to contract and shrink. You will also be given an IV medication called oxytocin. Oxytocin is a hormone produced naturally by the human body. It causes the contraction during labor and delivery and causes the uterus to contract back to its usual size after birth. You will have some pain in the tummy when breastfeeding. This is due to the uterine muscles contracting when oxytocin is released. The pain will reduce over time and you can take pain medications recommended by your healthcare provider before feeding your baby. Next, we'll talk about pain. So as mentioned before, you will have some tummy pain when you're breastfeeding. You might also have some pain in the perineum area, which is the area between the vagina and the anus, especially if there are abrasions, tears, or if your doctor had performed an episiotomy to facilitate the birth of your baby. There are topical numbing creams and sprays that you can use to relieve the pain to the perineum area, or you can talk to your doctor about pain medications. You should also take lots of rest, reduce activity, and walk slowly when you must be up and about. You may also experience a burning sensation with urination. Running warm water over the area while you urinate will help to reduce the intensity. They will give you a squirt bottle in the hospital. Well, they do that in Canada anyways. I know in some countries you'll have to buy this prior to your labor and delivery. Either way, you should get one. It is a lifesaver. Or you can use a sitz bath. Next, vaginal bleeding. Whether you have your baby vaginally or via cesarean section, a C-section, you will have vaginal bleeding. This bleeding will be heavier the first few days after giving birth and can last up to 6 weeks. However, the volume should start to reduce and the color should start to change from a bright red to a pink and then to a brownish color, then a pale yellow or white color. Important to note, if you are not breastfeeding, your period will resume, usually within a month of when you have stopped breastfeeding. You may see clots and tissues in your flow. This is normal. Your healthcare provider will let you know what to look for and when it's time to contact your doctor. We all know that pads are uncomfortable, but please do not use tampons during this time. Your body is trying to expel the extra blood, clots, and tissues from the uterus. Next is bowel movements. So most women will have a bowel movement within 2 to 3 days after giving birth. This will return to normal over a short period of time. Some women even become scared to have a bowel movement after having a baby due to the pain to the perineum area, especially if they have stitches. Ensure to consume a high-fiber diet and ask your doctor for stool softeners to avoid needing to force when you do need to go. This brings me to my next point: hemorrhoids. Some women, like myself, get hemorrhoids during their pregnancy. As a matter of fact, hemorrhoids were one of my very first pregnancy symptoms. Other women develop hemorrhoids during their delivery. Hemorrhoids develop when the veins around the inside of the anus bulges out, and this will cause pain, irritation, and some bleeding. There are creams you can buy over the counter for this, or you could talk to your doctor about medications that you can use to help relieve this discomfort. Again, you will need lots of fiber in your diet, increase your fluid intake, and if you need to, talk to your doctor about stool softeners. Following this, we have breast changes. Your breasts will increase in size and they will become heavier due to milk production. They will hurt, become engorged, they will leak, so you will need breast pads, especially when going out. As baby feeds, your nipple will become sore. They'll scab over and they may even bleed. Get yourself a nipple cream and use it frequently. Also, the increase in your breast size could cause some back pain. Ensure to wear comfortable, supportive nursing bras. I will be uploading a video on how to relieve the engorged breast and blocked milk ducts, so subscribe and click the notification bell so you don't miss it. So now we'll talk about a couple of things you should pay attention to if you've had a cesarean section. This is where the doctor performs a surgery to remove your baby. This will take a few weeks to heal. It is normal as well to have some pain to the incision site. It will help if you guard your tummy while you cough, sneeze, and it is also important that you're not forcing while having your bowel movement, as this could cause your incision to open up. Your nurse will give you instructions as to how to care for your incision, follow-up appointments, how to recognize signs of complications, and the signs of infection, such as green or yellow discharge coming from the incision site, redness, it is more painful than before, it is warm to touch, and there's a foul odor. You should also contact your doctor immediately or go to the nearest emergency room if your incision has opened up or started to bleed. Points to remember. Rest. Your body needs to rest. It has a lot of healing to do. Wear comfortable, supportive bras and loose fitted clothes. Do not use tampons. Absolutely no heavy lifting. This will cause hemorrhaging. Pay attention to your vaginal bleeding and your incision site. Remember, any yellow, greenish discharge or foul odor is an indication of an infection. Consume high fiber diet, lots of fluid, and ask your doctor for stool softeners. Ensure you have a squirt bottle or a sitz bath. You will need it. If you have any questions, leave it in the comment section below and I will certainly reply to you. If you found value in the content, support the channel by giving the video a like so it can reach lots more expecting moms all over the world. And subscribe so we can build a community helping each other. Congratulations, and I wish you a safe, smooth, and a super short labor and delivery. Thank you so much for watching. I'll see you again soon.